Poop your brains out. My goodness, don't poop your brains out. Poop, my goodness, my goodness. That is a tough one. Don't poop your brains out. What is it that we're talking about today? It is important that we do that because it's important that we talk about this because there's a new study out there. And if you watched our show, our video on Dayspring Life or on Dr. Ortin's channel, we posted a video about this. We just want to do a live show today about it. So if you haven't watched, I'm going to present more information. And if you did watch, there's more information out here for you because there's only so much you can say on a video that is recorded, but on a live, you put your heart out there, and a lot of things come, unedited. So today we're going to learn more than what we posted. But that being said, just make sure you check that video out for concise information. If you just want to hit out on the main points of our show, of our video, on this information. All right. So that is what we are doing right now. All right. All right. So we are seeing that don't poop your brains out. That is our topic for today. What does it mean to not poop your brains out? It is important. Now, a study out there um, looking at about 500,000. Let me just move to my next scene. A study out there which focused on about 500,000 middle-aged adults from the UK Biobank has come out with a very important information about the link, a potential link. I think there is a link, but there's more to be done to ascertain what kind of link it is. But at least in the interim, we have seen that use or frequent use of OTC or over the counter laxatives is leading to an increased risk of dementia. That is strange. I don't know if you know about dementia, but just for context, we're going to talk about what dementia is, just so you know, and we will then come together with a link and everything. So just right off the bat, just to put it out there, that is the information. OTC use, or the use of laxatives, I should say, using laxatives frequently has been linked to increased incidence of dementia. Dementia is a potentially dangerous disease. I mean, it's not potential, it is a dangerous disease. But OTC use has been linked to the development of dementia. And so we're going to talk about what it is that they found in the study. Uh, one thing that they did talk about is what kind of over the counter laxatives actually were associated with an increased risk of dementia. So we're going to talk about what kind of laxatives were involved here. We're also going to talk about how the study was even done, just as a little bit. We don't want to bore you with the academics of a study, but we're going to talk about, in general, the study, and then we'll talk about what kind of laxatives were involved. And then we're also going to talk about what may be happening, what is potentially going on when people use over the counter laxatives for chronic constipation or frequently to relieve themselves. What is actually happening? What is the potential biological process going on there? So we're going to talk about that. And then we're also going to talk about what are you most likely able to use in place of over-the-counter laxatives in case that link is something you want to prevent. If you want to really prevent your incidence of dementia and you are frequently constipated, what can you do? In other words, what can you use in place of the over-the-counter laxatives, just so that you don't end up with a statistic? We're going to talk about the numbers. And let's see if there's any other thing that I'm going to talk about. And then overall, my impressions about the whole idea of this research. So it is something that we really definitely need to ensure that we stay tuned throughout an entire show to find out what is going on. Because in my practice, I see a lot of people coming to me. I'm a pharmacist, if you did not know, and many people come to me. I would say that potentially the number one thing that people come to us for with questions about either they want to treat a diarrhea or they want to treat a constipation episode or something of the sort. Of course, there are other issues, but this is something that people come to me all the time quickly because you before you get an appointment for to see your doctor to get medications for diarrhea, you could potentially get something on the shelf and, and get it stopped. In the same manner, if you are also constipated and you need a relief, you probably wouldn't see your doctor right away unless it's consistent or chronic, right? And so many people come to me in my practice and ask about how to treat constipation. So I know a lot of you out there who are watching today have had a constipation episode, one or the other, and potentially most of you have it ongoing chronically. But we want to talk about whether or not it is safe to use over-the-counter laxatives consistently or frequently for the constipation that you have. And in relation to the study that I'm talking about. And then, of course, I'll provide my own potential solutions to some of the things that you can do to prevent you from using OTC laxatives, which incidentally, according to this study that we're going to talk about, is leading to increased rates of dementia. All right, so that is to say the bare a summary of what we're going to do. Now, if you agree with me, I want you to hit the share button. I want you to hit the thumbs up because this information must not stay with just you and I. We got to make sure that other people are also learning what we are going to learn today because it is huge. Right. So now let's talk about some of the things. And um, before we actually talk about it, what is dementia? I just want to hit on what dementia is because you may have just tuned in and you have heard about dementia before. But what is dementia? Is it a really serious disease? And if I'm using laxatives to treat my constipation, why should I be worried about dementia? What is dementia? All right, so let's talk about dementia quickly and then we'll come back to our subject. That way you understand why um, knowing that too much laxatives is bad will make more sense to you because you want to prevent dementia. So what is dementia? That's what we're going to talk about right now. So dementia, according to my little thing here, dementia, we're going to talk about, of course, laxatives and understanding the link. Dementia and laxatives, and then how you can potentially understand the link. That's what we're going to try and talk about. So, what is dementia? What is dementia? Let's see what dementia is. Dementia. And that's the first thing we're going to talk about, right? Dementia is a general term for loss of memory, loss of basically brain function, general loss of memory and other thinking abilities, severe enough to interfere with your daily life. So that is in a short what dementia is. So it's a cognitive disability, or I shouldn't say disability. It's a cognitive process. It's a process that affects your brain. Loss of neurons or loss of memory cells that eventually lead to you not being able to do your regular daily life activities that you would want to do. So that is what dementia is in its natural definition, right? So the causes of dementia. What usually causes dementia? Now we are saying that potential overuse of over-the-counter laxatives can lead to your increased risk of dementia. But generally speaking, what usually causes dementia is Alzheimer's. Most of us know what Alzheimer's disease is, right? Generally speaking, it would be Alzheimer's disease. Other forms of things that cause dementia would be a vascular disease, maybe a stroke. You had somebody has a stroke, and then they have a new fat in the brain. Some portion of their brain becomes affected. The cells not work any good anymore, and for that matter, they cannot remember. They cannot do their daily life activities. So that becomes a cause. So stroke or vascular disease can cause that. Parkinson's disease, also a neurodegenerative disease or something also that affects the brain cells, also can cause a general loss of memory. Remember, dementia is a big term that covers all these things, right? And then Huntington's disease can also cause dementia. And the other one that has become more evident these days is traumatic brain injury. We've been hearing about football players having to donate their brains because in their later life, sometimes not even in their later life, after their professional careers, they begin to see the effects of dementia as a result of the traumatic experiences on their brain as they play their game while in their prime. So that is one thing that also causes dementia. And of course, the infections such as HIV can also cause dementia. So on a general note, these are the things that cause dementia. But I don't want us to add laxative use to it. And that is why we are on this show. My goodness. I don't want us to add laxatives because these, as much as we don't want to have dementia, these may be a little rare. Some of these are associated with, old age and stuff like that. But laxative use, most people start using laxatives even in their teenage years. So we want to see and make sure that we don't add laxatives as one of the causes or some of the causes of dementia. And that is why this show is very important, that we watch it and see what other things we can do to avoid using laxatives because of what the scientists are saying right now. All right. So let's move on. So what are signs of dementia? Signs of dementia include memory loss, right? As I already alluded to, it's a hallmark of the disease, memory loss, and also obviously it is something that happens with your communication and speech. People with dementia eventually are unable to communicate or speak. And another sign of dementia is also confusion. People with dementia become confused sometimes, not able to articulate or comprehend issues that are around them. And then obviously people with dementia also have problems with the things that they used to know and do well. And if it is recall, even some patients with dementia are unable to tell their own spouses from other people or their own children. They cannot even identify why. Not only have their memory gone, but they cannot associate things that were very familiar. I mean, even if you forget, chances are that if you see a picture or somebody who you have lived with, you should be able to know that this person is, this person or that person. But because of the problems with even doing familiar tasks, such as bathing, such as eating, and to the extent that even your own pictorial view of life changes, you can't even remember things that you naturally would close your eyes and be able to tell. Some of you can tell who is around even just by the smell. This is your wife, this is your husband, this is your child, because you are used to them. It's a familiar thing. You don't have to even remember. So dementia also causes problems with doing things that you would naturally be able to do even with your eyes closed. So those are some of the signs. So it's a big disease. It's a serious disease. And to have laxatives being associated with this disease scares the heck out of me. And I hope you too are scared. I hope you are scared also. My goodness. My goodness. I hope you are scared. Yeah, all right. So let's move on. Now, the other one, as I said, is impaired judgment. The last one we want to talk, there's more, but in the interest of time, because we want to focus on the association of laxatives with dementia. But if somebody is having impaired judgment, that is another sign. Not all impaired judgment is due to dementia, but at least I just want you to see how serious this thing is. Impaired judgment, not able to even figure out how far the street is from you or how far a car is coming, can make you get killed because you cannot, you cannot really judge the distance between you and a speeding car or something like that. So impaired judgment is one of them. So those are some of the signs of such a serious disease called dementia. And the other sad thing is that most people with dementia end up dying because they are unable to even remember how to swallow. Those familiar things that go on, and then eventually they can't eat and they die. So that is how serious it is. And so for it to be linked to laxatives, which we commonly use, to me is a burdensome thing. And I hope that is something we can do about it. And that's why we are here. So now, in order to even make it more real to you, let's talk about some celebrities who have dementia. And some of them have passed away. But the one that shocked me recently is This guy called Bruce Willis. Oh my goodness. I love this guy. I've loved Die Hard movies, and I've loved his movies. And when I heard that Bruce Willis has been diagnosed last year, I think if his family came out that he's been diagnosed with dementia. I was dumbfounded. In fact, it hurt me so much. See, he's my own brother. Of course, everybody is your brother, right? Because you know how much this man and his family are going to struggle through his life. He's only 67, and for him to get this disease right now, it's terrible. And that is why we want to talk about this because, hey, if we can prevent dementia, among other things, by just taking less laxatives, then so be it. We got to do it because from the science and the things we have already talked about, it is a terrible disease which eventually leads to the demise of the patient. And we don't want to be part of it if we have control. At the moment, scientists and all researchers have not been able to prove the definite cause of dementia. We just know that it's an issue with your brain, and the brain cells die, and then, like in this case of our gentleman here, Bruce Willis, he has been diagnosed with something called frontotemporal dementia, which basically is the loss of brain cells around the ear and in the front of his brain, around the ear and in the front. So that is, the cells there are shrinking. I mean, the nerves there are shrinking. The cells there in his brain are dying, and that is leading to the symptoms that has made them diagnose him with dementia as the disease. So that is terrible. So I'm just trying to tell you how terrible the disease is, and it does not discriminate. Somebody as popular and loved, like I'm saying, he's one of my my best celebrities that I love his spirit, his humor, his action films, and it's sad to see that he goes through this. But maybe we can use this as a way to teach ourselves and potentially prevent us ourselves and as well as our families, those we have control over, at least what we can do to avoid being in dementia, if really laxatives can do that. So that is something that we have come to see. Now there are other stars apart from Bruce Willis. There is President Ronald Reagan. President Ronald Reagan actually passed away. He passed away also from dementia, Alzheimer's. He passed away in 2004. A former president of US. He also announced before he died that he had dementia, and that is another sad case. Very people who would potentially have all the money they have to be able to treat, they passed away, and they could not prevent it. So if you can't prevent it by the way of life, by reducing the use of laxatives, why don't we talk about it? And that is why we want to do that. And the other person is Glenn Campbell. I actually don't know this man, but apparently those of you who are into country music, this man also passed away in 2017, also from complications of dementia. So that is what we have seen, what dementia can do. But now, with that on the side, what can we do? Having seen this, that dementia is a terrible disease, having seen that it's something that we can probably not prevent if we have no tools, then what can we do now? Because if this association is for real, if this link they are saying is for real, then we have to do something about it. We definitely have to do something about it. And so let's go on to our main topic again. We are saying that dementia is associated with increased use of over-the-counter laxatives. Over-the-counter laxatives. And so now that we know what dementia disease is, I'm pretty sure you are ready to listen and to share, because if you can prevent it, then so much the better. It doesn't mean those people that we saw had dementia as a result of the use of over-the-counter laxatives. No, that's not what that means. What that means is that there are causes that we don't know. And if we found one that we can prevent, then we got to take care of that, because in that case, we'll be doing ourselves what? Good. we'll be doing ourselves very good. All right. So, what are some of the things that they found in the study? Again, the study, as I said, had 500,000 people who were observed. And these people took three groups of over the counter laxatives. And the first group of laxatives that they took, let me just make sure that I don't make a mistake. The first group of laxatives that they took were called the asthmatic laxatives. The asthmatic laxatives. And of those, well, even let me backtrack a little bit. So when they did the study, after they observed the over 500,000 people who over the 500,000 people who had who were observed, after they observed them, they saw that the people who used over the counter laxatives for frequent constipation treatment, or frequently every week, multiple times a week. And that's the key. They used it multiple times a week. These people who they saw in this study. And these people who used it multiple times a week, among the 500,000 people from the UK Biobank, 51% increased rate of developing dementia, all cause dementia. In other words, when they observed them, the people who used the over-the-counter laxatives to treat constipation frequently in a week, every week they used multiple times, they had 51% increased risk. That's the key. They had 51% increased risk of developing dementia, which is huge. My goodness, 51%. 51%. I don't know if I should applaud or scream. My goodness, 51% of the people, 51% increased risk of developing dementia. So, and that is not it. That is not just it. That is all cause dementia. Now, when they see these people, again, when they actually went down further, they're saying that the people who use asthmatic laxatives, you know, the asthmatic laxatives, the people who use asthmatic laxatives were people. Well, let's talk. What are the asthmatic laxatives? The polyethylene glycol, what we call the Miralax or polyethylene glycol over the counter, the powder that you mix in a liquid and then you drink. As when we tell people to drink all the time when they have constipation, those are osmotic. Another kind of osmotic laxative is a lactulose. You know, we make you drink lactulose. Those in the US, those are prescription only. And the other kind is milk of magnesia. So these are just three of them. The people who use this group of laxatives, they had 64% increased risk of developing dementia. My goodness. Now, that is dangerous. You know, I need to have a better sound effect to show this, but that is dangerous. 64% increased risk of developing dementia. The people who use this. And watch out, that's not even the fun part. That's not even the worst part. There's a worst part, right? The other group that used over-the-counter laxatives, this group of laxatives is what we call the bulk forming laxatives. This is what we sell here in the US as fiber capsules, you know, stool softeners and stuff like that. The people who used that is one group. And then the other group of laxatives, also called stimulants. We have Senna laxatives. In the US, we got a Senna or Senna card as a brand name. And then also in other places, they may just cook the Senna leaves and you just drink the leaves, you know, when you boil it. Those are all Senna. And then also there's another stimulant laxative that we call bisacodyl or bisacodyl, depending on where you went to high school. I call it bisacodyl. All right. Yeah. So the people who used the bisacodyl laxatives, brand name in the US, we call it Dulcolax. If you see it, green box, most of the time I can picture it in my eyes right now. Green box. The people who use that, as well as the people who use the fibers and the stool softness, putting them together, this group of people among the 500,000 that were studied, they had an increased rate of dementia, increased risk of dementia up to 90%. Oh my, 90%. My goodness. My goodness. My goodness. 90%. That is huge. They had 90%. 90. I'm not kidding you. They had 90% increased risk for dementia. Now tell me this is not dangerous. 90% chance of developing dementia just because they used these laxatives frequently per week. Now, now the question is, why would anybody use laxative frequently per week? We understand that some people have chronic constipation and other issues going on that makes them need laxatives all the time, and that makes sense. If you need it, you need it. But don't end it. Don't end it there, because I'm going to show you, and we're going to show you how to avoid frequent use of laxatives by just adjusting your lifestyle a little bit. And this is where my profession comes in right here. So I'm going to step into that in a minute. Let me see if I'm doing on time. Yes. So I'm going to do it. I'm going to show you why you should not do that if it's at all possible. I'm going to try. But before I do that, let me explain what may be happening. As I started earlier, I said I'm going to try and explain what may be the reason why these people are developing an increased risk for dementia, or the people who used laxatives frequently in a week, why they may be having issues with dementia, or maybe having dementia higher than the other people who did not use. I'm going to explain what may be happening. All right. And the first reason that I have come up with, and this is also agreed upon by other scientists, that is that potentially when people are frequently pooping, when people are using laxatives, OTC or over the counter laxatives to clear their bowels, what they may be doing is they may be clearing also, along with, of course, the poop that they are trying to get rid of, they may also be clearing some good bacteria, what we call, the good and healthy bacteria in the gut. Everybody has some bacteria in the gut, in the colon, in the intestine, all the way down from the mouth, all the way to the anus. That are helpful. They are not just there for being their sake. And if you use laxatives so frequently, you are clearing them out. And so the idea is, if you are clearing your good bacteria, you may be giving chance for harmful bacteria, which may also be harmful to your brain. Now, you may ask, how can the brain have any effect if it's in their gut? The brain is linked to every part of the body. There are nerve endings in the gut. And if you are damaging, if you are striking an imbalance in your microbiome, if your bacterial population in the gut, what it has to be is not because you are constantly going to the restroom, because you are using frequently. That's the key. Because you're using the laxatives frequently, you are clearing your bowels. You may be also thrown off the balance, and this imbalance is the one that is potentially causing the harm to the brain, and as a matter of fact, to lead to dementia, because there's got to be something there that is doing that. So that is the first reason. The other reason why dementia may have increased in the people who use frequently these laxatives is that some of the laxatives by themselves may be toxins to the nerve endings. As I said, there are nerve endings in your gut, and if these strong laxatives are constantly being used, they are constantly being there, then they may be poisoning or damaging the nerve endings of your gut. And if that happens, what is going to happen is that they're going to send some information to the brain that, hey, there's something wrong here, and the brain may just self-degenerate in some form that may lead or may be leading to the dementia. So these are all potential reasons why this may be happening. So that the first one is the imbalance of the microbiome, or of your good bacteria in your gut. The second one is the harmful effects of the uh, the um, the laxatives themselves that may be causing that. And then also there may be other things going on. There may be other things going on. If you are damaging the nerve endings, then of course you are destroying the brain as a result, because the brain, the extension of the nerves through your spinal cord to every part of the brain as part of the nervous system. And so if anything is happening to it, then of course that can be the reason why you are seeing an increased risk for dementia among people who are using laxatives frequently, multiple times per week. That is what may be happening. And so, with that being said, so that is mine own explanation for what may be happening. But the most important thing is, how are we going to ensure that we are not using laxatives too frequently? Because the key is that's the whole purpose of this show. If using it too frequently is leading to dementia, then what are some of the reasons? What are some of the ways we can use? That way we avoid using over-the-counter laxatives. And that is, I think, the most important part of this show. All right, because we're going to show you what you can do to potentially reduce the use of over-the-counter laxatives, which are the culprit right here. And the first thing that I say you would do is to exercise. Now, everybody knows that I am very keen on exercise. All throughout my training in pharmacy school, there are about three themes that came through every disease state that we discussed. Every disease state. If you stop, the first thing is stop smoking. Stop smoking. Every disease state, smoking seems to be everywhere, but that's not what we're talking about. The next thing is exercise. Exercise is everywhere. As a matter of fact, I actually wrote this down and I went to the Society or Association of Alzheimer's Disease site just to see what they also say. And I saw they are also talking about the same thing, exercise, as a means of preventing dementia. But even still, exercise here is something that is going to help you to become regular. When you exercise, what happens is that the gut, the smooth muscles in your gut, there are muscles, in your gut. When you exercise, the muscle tone increases. Your gut the smooth muscles begin to squeeze, contract, and relax. And squeezing or contracting and relaxing is the action of movement. Most of the laxatives that we use, some of them I should say, especially the stimulants, what they do is they cause your gut to move. That way you go out and you poop. And so if you exercise, you are naturally doing what the laxatives would do, but in a milder form, so you don't like over poop or take out everything. So exercise increases your gut's natural muscle tone, the smooth muscle tone, so that you become regular. So if you are using so many times over-the-counter laxatives, and we have seen that there's potential association here with dementia, then the first thing you got to do is to stick to exercise. Now, if you're exercising and you're still constipated, then we're going to add a few more things. But maybe you need to exercise more. That is the key thing too. Exercise more and see your rhythm, your bowels move. Write it down and come back and tell me in a comment section some other time that it didn't work, because it works. It works for me. It works for everybody. Exercise in particular. Excuse me. If you are this kind of person who wakes up in the morning and then you go straight to exercise, you are going to do it. And that leads me to the next point. The next point is drink more fluids. Some people don't drink. The only time you see them drink is when they are eating or when they just finish eating, then they drink. Apart from that, if they are going to drink, they are drinking juice or something else, which is sugary, which doesn't help with bowel movement anyway. So drink more fluids, in particular, drink more water. And if you are going to exercise in the morning, you wake up in the morning, you drink a glass full of water, maybe an 8-ounce glass of water, and then you hit the gym or hit your wherever you exercise, your basement, wherever you go to exercise, hit it with a full glass of water and watch you go after when you sit on the bowl. Now, if you do this and it doesn't work, then we have more problem. But then that's not the end. We're going to add more. So exercise plus fluid intake, fluid drinking, water drinking in particular, especially in the morning. When you wake up in the morning, first thing, a full glass of water or however much you can drink, even if it's 2 glasses, just drink it right there. By the time you finish brushing your teeth, doing your regular errands, exercising, as you sit on the bowl, I'm telling you, you are going to go. You're going to be regular if you do it consistently. So exercise and water drinking. That is two things that will help you stay regular. The other thing is that you eat foods that are rich in fiber, natural fiber. Cut down a lot on the processed food. If you eat more processed food, chances are that you are going to be constipated. Maybe your constipation is from processed foods. If you can cut down and if you can eliminate processed food, even better. But if you can't and you can even reduce it, see these three things adding together: exercise, drinking more fluids, and eating fiber rich diets is going to help you stay regular, and you're not going to need so much, even if you're going to need it because you are naturally constipated all the time. If you do this, I'm telling you, it's going to reduce. You are going to become a little more regular than before, and you won't need these harmful over-the-counter laxatives, which have been associated with increased incidence of dementia. That's the key. And that's why I told you the kinds of people who have dementia, prominent people, and there's no cure for dementia. And so if you can prevent it, even better. And these are simple things that you can do. The other thing is that I think I said eat foods rich in fiber, drink more frequently, and lastly, what I'll add is if your dementia is so severe, I'm sorry, if your constipation is so severe, after doing all these three, then talk to your doctor and see if adding a probiotic supplement from the shelf may be ideal for you. Because for some of us, our microbiome, the population of bacteria in your gut is off. And because it's off, your foods are not easily digested. Your foods are not easily digested. I'm trying to rattle through with all these big terms. Your foods are not easily digested. And so adding a supplement of a probiotic capsule, 15 billion or 15 billion or 20 billion cells, higher, may be the trick. It may populate good bacteria in your gut and help you naturally go. That has also been proven to work. So these four tips can help you stay regular and prevent you from becoming chronically constipated. Now, I am not oblivious to the fact that some people have colon related diseases. If you have IBS, the IBS itself can lead to either diarrhea or constipation. So if you have IBS with constipation, then of course I understand you are chronically constipated some way, somehow. But these things will work. Constipation is constipation. I know your IBS is irritable bowel syndrome. Your IBS is leading to your constipation. Fine. Add these tricks. Exercise, drink more fluids, cut down processed food, and add fiber in your diet. And then, if possible, with discussion with your doctor, see if you can add probiotic, and you will become somewhat regular, if not completely regular. And even if you achieve the point where you can stop using one time in a week, if you use the laxatives 3 times a week, and if these things can make you use it only once, you have saved yourself a lot from the risk that we have already discussed. These are huge risks. And as we have said, nobody knows the complete cause of it. We just know that it is cognitive decline from neuronal cell death or brain cells dying, leading to memory loss and other functions that we lose. And so, if this association that we have gone through, if you joined us late, make sure that after the show you go back and start and see why we are saying that you need to treat your constipation differently, because there is a reason, there is an association according to a new study. It was just done in February. This reason is that there may be more incidence of dementia among people who frequently use over-the-counter laxatives. Go back after the end and see why. We talked about celebrities such as President Reagan, and more recently, Bruce Willis, movie actor who has been diagnosed with dementia. Now, if we can do things differently and protect ourselves, why wouldn't you? That is why we are here. And so that is where we are going to put the show to an end. And I'm hoping that you have enjoyed it. Make sure you share it, click the thumbs up, and make sure you follow. If you're watching on Facebook and you don't follow, you are not doing yourself good and you're not doing me good either. And if you're watching on YouTube, hit the subscribe button so that you can also receive alerts and become part of our community. Wherever you're watching from, make sure you like it on wherever, LinkedIn, wherever. Eventually, we are going to tailor this to maybe just a couple of sites. But for now, make sure you are subscribed on our YouTube channel on the Life and Health Show or on Dr. Otin channel on YouTube. And then on Facebook, you can also find us on the Life and Health Show or Dayspring Life and Health. And I want to say thank you for staying with us. I'm hoping that you have found value in this show. And as we always say, beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for sharing your afternoon with us. God bless.